Hi, my name is Jason Reynolds, and this is the presentation on diabetes mellitus type 2. For the background on diabetes, first of all, there's two different types of diabetes. Type 1 is where the pancreas no longer produces insulin. It is typically diagnosed early in life, whether it's in childhood or early adolescence. It can be diagnosed later in life, however, it's just not as common. Treatment, because the pancreas does not produce any insulin, treatment is via insulin replacement through injection. Type 2 diabetes, on the other hand, is defined by insulin resistance. The pancreas makes insulin, but it doesn't function optimally. This is typically diagnosed in adulthood, but again, it can be diagnosed in children. We'll discuss whether that happens a little bit later. But the treatment is via a variety of different oral medications. However, if they're not achieving goals for A1C, type 2 diabetics can be treated with insulin as well. So you can see in the diagram, for type 1 diabetes, there's no insulin in the bloodstream. Insulin is not produced by the pancreas, so it's just not there to move the glucose into the cells. Whereas in type 2 diabetes, the insulin is there, but the cells are resistant to it. They're not responding to the insulin. And so basically, the pancreas has to overproduce, has to produce more insulin just to achieve the same effect that a normal person would achieve with less insulin present. So that's the basics of the disease. The public health impact, first of all, diabetes affects 1 in 11 Americans. More than 30 million Americans have diabetes. And roughly 84 million Americans have prediabetes who may develop the full disease later on. They don't even know that they have the disease. Diabetes is the leading cause of non-trauma lower limb amputations, the leading cause of new cases of blindness, and the leading cause of kidney failure in the United States. Roughly 60% of diabetics also die from cardiovascular disease. And diabetes represents about 14% of the total cost of healthcare in the United States, which comes to a total of about $327 billion per year. So 1 in 7 healthcare dollars are spent in treating diabetes and its complications. And the incidence of diabetes basically breaks down to over 4,000 Americans who are diagnosed with diabetes every single day. So the signs and symptoms of diabetes, there's some overlap for sure between type 1 and type 2, but typically new onset diabetes patients will experience increased thirst. This will cause patients to be drinking water all throughout the day, but also waking up several times through the night to drink some water. They'll also have an increased hunger, and this includes still feeling hungry even after eating. They'll experience dry mouth, even though they're drinking lots of water, they're actually dehydrated because of frequent urination, and they're drinking lots of water because of the dry mouth and just the overall feeling of thirst. They're also very fatigued. They're not getting the glucose into their cells that need it, so they're actually not getting the energy from the food that they're eating, so they feel tired all of the time. Again, because they're not getting glucose into the cells that need it, they actually will have a rapid unintentional weight loss. They're not getting the nutrients they need from the food to lose weight. Diabetes will also affect their vision. They will have poor wound healing. Type 2 diabetics specifically will get something called erythematosus nigricans, which is dark skin changes on the neck, the armpit, and the groin. And they can also develop neuropathy that causes numbness and tingling in the extremities. So for diagnosing diabetes, There's several different tests that can be done. Uh, First of all, we can do the fasting blood glucose, where one abnormal test isn't sufficient to diagnose the disease simply because your blood glucose will vary, um, fluctuate throughout the day just based on what you ate and that sort of thing. The timing of the test as well compared to when and, um, affect the outcome as well. So you should be fasting. When you go in for this test, if you have a fasting glucose of 126 or higher on at least two separate occasions, um, if you have hemoglobin A1C that is 6.5% or higher on two separate occasions, or if you have an oral glucose tolerance test, which is 2 hours, um, a blood glucose test 2 hours post taking glucose by mouth. Um, if it's 200 or higher, then you can diagnose the patient with diabetes. So the high risk groups, people who are most at risk of developing the disease, um, we found that diabetes has appeared or affects more often certain racial and ethnic minorities, including African Americans, Latinos, Native Americans, Asian Americans, and Pacific Islanders. They all have a higher prevalence of diabetes within their populations. Um, Type 2 diabetes typically is diagnosed people in people who are older than 45 years old. It tends to affect people who are overweight or obese, people who have a family history of diabetes, people who have an inactive or sedentary lifestyle, people who have high cholesterol or high blood pressure, women who have polycystic ovarian syndrome, or women who had gestational diabetes during pregnancy. So these are the things that tend to lead to a diagnosis of diabetes later in life. So to prevent the disease, basically the mainstay of prevention is lifestyle modification. You want to maintain a healthy weight, which can be accomplished with a healthy diet and exercise, trying to be as active as possible, and also not smoking as well, simply because there's such an overlap between smoking and diabetes and the relationship with cardiovascular disease. We also want to do a good job of managing their health in terms of monitoring their blood glucose levels, trying to discover anyone that may have prediabetes, hemoglobin A1C. If it's less than 6.5, it's still higher than 5.5, kind of in that prediabetes range. So we want to keep monitoring the glucose levels. We want to control their blood pressure and cholesterol. Again, as these are indicators of cardiovascular disease and could be an indication of someone at risk for diabetes. And we also want to make sure that they are complying with their medications, whether it's the blood pressure medications, cholesterol medications such as a statin, or if they have been diagnosed with diabetes already, making sure that they're compliant with all of those medications, whether it's oral diabetes drugs or insulin. So some of the specific recommendations that they make are for exercise, 30 minutes of activity per day, at least 5 days per week, or 150 hours, 150 minutes per week of exercise. This helps lower the risk of developing type 2 diabetes by 58% compared to people who are completely inactive. And we also want to encourage the healthy diet that has less fats, more fiber, more whole grain, veggies, fruits, and lean meats. And so we also want to, or doing this should help control their weight and BMI. And if they're exercising and have a healthy diet, their BMI should be hopefully it's not below 30, I mean, it should decrease from wherever they're at if they're already overweight or obese. Case management, people who are diagnosed with diabetes should have a quarterly follow-up with primary care, so they should be seeing a primary doctor every 3 months. Um, you know, this is for a number of reasons, but because of poor wound healing and their inability to feel in their extremities, especially in their feet, we want to give a foot exam, check to see if they have any neuropathy developing, check to see if they have any sores that aren't healing on their feet, that sort of thing. And this is also a time where they can do their annual screenings for the hemoglobin A1C that measures how their blood glucose levels have been over the past 3 months. Checking their lipid levels, cholesterol, seeing if they need to be on a statin, that sort of thing. Checking their kidney function to see if they have any nephropathy, and then checking their eyes, the blood vessels in their eyes to see if they have any vision loss and blurry vision, with the goal of preventing any type of loss of vision or blindness. The goal for the hemoglobin A1C is 7 or less. Management can be tailored based on what this hemoglobin level is. For example, if they're right at or below 7, they only need to be on one drug, such as metformin. If they're greater than 7, they may need to be on multiple drugs to bring their hemoglobin A1C down. And if their current drug isn't working or multi-drug regimen isn't working, then they may require insulin to bring them down a point or two in hemoglobin A1C. And that's the nutrition. Thank you very much.